Hi, it's Dr. E from themanualtherapist.com. Today we're going to talk about standing posture and correcting standing posture because, again, posture is not just for sitting only. So this will be part 2 of my posture series. Nicole here is standing with a sway back. For people who have difficulty with static standing, sure, it could be core issues, could be lumbar derangement, something like that. Oftentimes easily corrected by alignment. So if you do a light vertical compression, often that will draw out what needs to be done if she shifts one way or the other, or in this case her pelvis is shifting anteriorly, as is the case with the sway back. What you want to do is correct, so first slight posterior tilt, then maybe get her sternum just a little bit more anterior, good. So if I retest again, actually I want you to relax your abdomen. Retest again, there's still, her pelvis is still shearing anteriorly just a bit. And I want you to rock back and forth on your ankles until you're evenly weight bearing between your heels and the balls of your feet. You will almost feel like you're ski jumping in a way, because you're probably going to be a little bit more forward than you think you should be. So stop when you're even between the balls of your feet and your heels. Even? Mm-hmm. Okay. So even when she's relaxed, as long as if this isn't a good neutral and her upper body is over her center of gravity is kind of in line with her pelvis, when I pull down, I should be able to really push down with a decent amount of force and not have her shear anyway. So that is just basically standing statically and bilaterally. These should also just be soft, but I don't recommend standing like this for a long period of time. If anyone has to stand behind a counter or wait in line, or if you have a standing job, what I recommend is also just alternating stride stance. So one leg forward, one leg back, and about 70-30 or 60-40 in terms of weight distribution. Still chest up with this. Every couple minutes you want to switch between one leg back and one leg forward. So a couple minutes go by, you switch to that, then you switch to this position again, and make sure you find your good, kind of ski jumping position. So I also stand like this because not only is this look like an aggressive posture, this is more of an open posture. It also pulls your scapula down and puts your head neck in a better alignment. So the last thing I do, which I'm sure looks probably very odd and irritating, is I never just stand statically. I always kind of shift back and forth. So I do think that my hips and my back always feel quite a bit better when I do this. So no one ever seems to question me when I do this in the clinic. I don't want the cameraman to do it.
You look good.
So you can stop then. But that's how I do static standing. If I'm ever watching over someone, I barely ever just stand in place unless I'm teaching, but I still try to walk around a bit, or I'm in church and everyone else is actually standing up straight. But still, that's kind of like Catholic aerobics. So that is just quick ways to fix static standing.